Okay, guten Tag. Mein Name ist Barbara Torres und im Namen von Gemeinsamen Bremen und Projekt Best Mom möchten wir Sie alle begrüßen. Seid willkommen in diesem Impfgespräch. Mit uns ist hier Frau Dr. Christiane Piepel. Frau Dr. Piepel ist Infektiologin und Oberärztin beim Klinikum Bremen-Mitte. Ja. Good afternoon. I welcome to all here to conversation about the vaccine. And I want to present here Ms. Dr. Piepel. She is infectiologist at the Klinikum Bremen-Mitte Hospital. Now I let my colleague Nora or Toby continue with these conversations about the vaccine. Thanks.
Nora, bitte.
Yeah, my name is Nora Mafodesi. I'm project coordinator for the project Best Mom. Our aim is to support the African women, mothers, and their children to make a better living out of them. Our aim is also to make sure that the role models, not only for themselves, but also for their children. And today, we want to discuss about the vaccine, which we have a lot of questions to ask about. And we invite the women from the living homes to ask questions willingly, freely, so they can be educated more about the vaccine. Thank you. Toby?
Yeah. So I have here with me, please, I would love if you can tell us what coronavirus vaccine is, so that we can have a little more understanding of what the vaccine is.
Okay, so I think coronavirus, most of you know, or all of us know, and the vaccine is a medication, like other vaccines as well, you know, probably vaccines for measles or for tetanus and so on, and diphtheria. And that means that you give the body a very little small piece of the virus so that the body can already train to have a good weapon against the virus when it comes. So usually you give very, very little parts so that when the virus enters into the body, your body knows already, oh, this is a foreign thing, this is something that can make you sick, and I have to fight against it. Normally, when we have contact to a virus, it normally takes like 7 days until 10, until 14 days, until our body starts having a good answer, like a good, starts to have good weapons against the disease. And with a vaccine, you can already give the body the information and the training before the real virus comes. So actually the body then is prepared and protected so that when you really get infected with coronavirus, that you don't get sick and that your body can kick it out of your body quickly.
Okay.
So that's more or less how a vaccine works.
Okay.
I also have a question. What will happen if you don't get vaccinated?
If you don't get vaccinated, most probably you will be infected with coronavirus because it's a worldwide disease. And that means that it has a very, very high rate of transmission. So it's very likely that you will be infected with coronavirus one day. The problem with the infection with coronavirus is, you know, already we have many, many million deaths worldwide already of people dying from a coronavirus because it's a new disease that our immune system doesn't know so far. We have high death rates within people that are very old and people that have diseases, so especially for people with immunocompromised health, and as well, for example, you have higher problems or risks of having a severe disease and higher risk of death in pregnant women as well. So you would, when you get vaccinated, you can protect yourself, and as well you can protect the people all around you, because you are a lot less likely to transmit the virus to other people. So when you go and visit people that are sick and that are older, you can be more confident that probably you will not give them coronavirus, even though perhaps you don't even feel yourself that you have it. As well, you have some really little babies, like the newborn babies, that can have problems with coronavirus. So altogether, it's a good idea that all of us get vaccinated, because then we have a high chance that we can as well protect the groups in the community that are the most vulnerable. And of course, we can protect ourselves and our families. But I don't know if that was the question. The vaccine is not compulsory. So that means everybody can decide if he or she wants to be vaccinated. And it's not that you will, there's no policeman or anything coming forcing you to vaccinate. So it's always your own decision to do that or not to do it. But it's highly recommendable because, yeah, you can protect yourself, you can protect others. You as well, you have the problem that even young people that get coronavirus, nearly 10 until 30%, they have long COVID symptoms. So that means for many, many weeks and months, they have problems in breathing. They are feeling very weak and can't walk so well. So even though you might, as a young person, not have a severe disease in the beginning, you have quite a risk as well to have long-term consequences of the disease.
Okay. Thank you very much for that.
Thank you. Thank you.
Yeah.
I still have a question to ask. How does the vaccine work in the body, and what about the side effects such as fever or headache?
Yeah, so the vaccine, normally you inject it in the arm, like in the upper arm. It's like there are different types of vaccines, but all of them in the end, they have one special protein that is very, very typical for coronavirus. And this protein is used or is seen by the body as a foreign body and as something that can be a threat that the body has to develop a strong answer or good weapons against. So that means that with this protein, you stimulate the body to have a good health antibody answer against corona. With any vaccine that you give, you always want your immune system to be activated. Okay, so if you give a vaccine for measles, for diphtheria, for hepatitis, for whatever, you always need your immune system to activate and to make a good antibody response. So the activation of the immune system, that can happen to any vaccine and is similar with any vaccine that you have, if you have corona or influenza or whatever. And that means in the first 1 to, well, not more than 3 days, it's more or less about 50% of the people that are vaccinated that will have a little bit of fever, that some of them will have a headache or they will have pain in their joints. Some of them will have shivers, but it is in the end, it's a sign that your immune system is working for the vaccine. They have even found that people that have more symptoms, that have more problems after the vaccine, and they feel that something is going on, they even have a stronger antibody response. So in the end, it means that your vaccine is working very well, and that is just the normal vaccine reaction. Younger people tend to have more. So old people, often they don't even notice anything with the vaccine, but with younger people, it is more common that you feel something. And it takes more or less 48 to 72 hours if you have it. That's more or less what you can have. You can have, always you can have allergic reactions, because it's a new thing to your body. So for an allergy, you never know before if your body might have an allergy towards any of the substances. because if you have never had it before, you don't know. So principally, yes, you can have an allergic reaction. And for 2 vaccines, for AstraZeneca and for Johnson & Johnson, they had seen that for younger women, and at the moment these are not given to younger women, that for younger women you had a chance about 1 in 100,000 people. Like if you vaccinate 100,000 women between 20 and 60 years, that about 1 person can have an embolism. This is extremely rare, but they still said, okay, this risk is not so high for people being older, so these vaccines are just given to people being older. But for anybody of us, we would not receive these vaccines anyway, and it's extremely rare.
Okay.
So I still have a question. How true is it ahead of people being vaccinated and weeks later they get infected with the vaccine? Is this true or false?
That people have the infection even though they are vaccinated?
Yeah. People still get the COVID virus, after being vaccinated, they still get infected with the virus.
Yeah. So for most of the vaccines, you need to have 2 vaccines. So you get the first one, and the second one depends on the type that you have. You get 6 weeks or 12 weeks later. And then you need another 2 or 3 weeks until your full protection is established. The vaccines, they have an efficacy of more or less 97–98%. So that means 98% won't get the disease. But that means as well 2% will get the disease still. So if you have 100 people being vaccinated, 98 of them, they will not have any problem with the disease, but 2 or 3 people might or can be infected. The protection against having a very, very severe disease, meaning that you would have to go to the hospital, that you would need oxygen or have to go to intensive care, that is with all the vaccines about 100%. Sometimes you have people with a very weak immune system and very, very old people. For some of them, the immune system is so weak that even with the vaccine, you can get coronavirus, because your immune system is so weak that with the vaccine, it cannot develop a strong antibody answer. So we have some people with cancer, with chemotherapy, that are vaccinated and that still get the disease, but they get any other disease as well. They would get all the other diseases that you can vaccinate against as well, because their immune system, it is so weak that it cannot handle any disease or any vaccine. So yes, you will have some people still getting the disease, but 98% around will not have a problem at all.
Okay. So I still have one more question. What about mothers that are breastfeeding? Are they allowed to be vaccinated?
Who?
Mothers
Mothers.
that are still breastfeeding their babies.
Yeah.
Can they get the vaccine?
Yeah. So in the first studies, like when they examined the first 20,000, 30,000 people, they did not examine any pregnant or breastfeeding mothers. So when they started doing all these studies to see if it's working, they excluded this group. That means that we think probably it's safe, but we have no data. And therefore, in Germany at the moment, they do not advise to vaccinate these mothers. In the UK, they have already started vaccinating, because they say, okay, we don't have the data, we haven't examined, but it's extremely unlikely that there will be any side effects for the mother or for the baby. And it's a much higher risk that the mothers or the babies will have big problems because of coronavirus. So for the moment in Germany, they are not vaccinated, but in the UK they are. I think during the next couple of months, we will get more and more information, because many mothers have been vaccinated anyway while they were breastfeeding and being pregnant, because somebody didn't take care, or because the woman didn't know that she was pregnant. And they are collecting all these data, and they will probably publish this data soon in the next couple of months. So then we will be a lot more sure what to do with breastfeeding women, and as well what to do with pregnant mothers. If I would guess, I would think probably in 3, 4, 5 months, we will start vaccinating all of them as well, because probably then we have all the data to be sure that it's fine.
One last question. I'm very, very curious about this COVID-19. It's no joke, because it's a worldwide pandemic. And this question is often, this question, excuse me, please. I have a mother here with a baby. I'm so sorry. Okay, my question is, does this vaccine affect fertility? Like, most male or female that are planning to have children in future, a lot of them are scared that if they get vaccinated, they might not be able to have children in future. As a mother, I'm so concerned about that I want to ask this question.
Yeah.
And I think you're the right person to give me the answer. Thank you.
So it does not affect fertility. Usually, like if it would be affecting fertility, then we still have to remember that the vaccine is an extremely little part of the coronavirus. So if the vaccine would do anything with fertility, then the coronavirus would do it much more. Yeah. So a woman with a coronavirus infection would, if there would be any damage of fertility, the woman with the infection would have much higher problems than a woman being vaccinated against coronavirus. But so far, like worldwide, there's none of these problems. So at the moment, what we're doing when I'm asked, like a woman who wants to have children, I would recommend go and get the vaccine now, and then start being pregnant like 2 weeks after the last vaccine, so that you are safe, that you're vaccinated before, so you don't have a high risk during pregnancy to get coronavirus, and that your baby as well has a lower risk to get coronavirus from the birth. So at the moment, we have they have huge data collections, but fertility doesn't seem to be an issue.
Thank you.
Okay.
Yeah.
So, thank you, Nora, for those questions. And I have here with me 2 questions.
Mhm.
At what point after being vaccinated should I go to the hospital when I have some effects? Probably, what signs am I supposed to see, or what signs can I see that okay, immediately I have to go to the hospital or check up after the vaccines?
After the vaccine,
Yeah.
um,
What is the worst symptoms I can see after being vaccinated?
I think so far hardly anybody ever had to go to the hospital. So what would be normal would be like 2 days of fever, headache, joint pain, shivers, something like that. If it's getting any worse than that, yes, I would go to see a doctor. But so far, I haven't met any patient who had to go. But that would be like the normal reaction.
Okay. Someone just sent a um question now. She said I was COVID-19 positive when I had my baby,
Mhm.
but they allowed my baby to stay with me and the baby didn't contact it. How is that possible?
Yeah, they don't know exactly so far. Many newborn babies don't get the disease from the mothers. You would usually tell the mothers that they should wear a mask when they are breastfeeding, but still so far it works quite well that the babies most of the time don't get it, some get it. There's one idea why that could happen, because when you are breastfeeding, you as well give your antibodies with the breast milk to the baby. So some of your antibody response, like some of your immune system, goes to the baby. So if you are yourself fighting against coronavirus and you have the antibodies against coronavirus, theoretically, it's imaginable that you can give it to the baby while you're breastfeeding. But it's amazing and it's great that most of the babies, fortunately, don't get it.
Okay. So she said she was being told she has COVID-19 without symptoms. She was
No.
not sick. She had. So how is that possible? Because a lot, just like the question she asked now, a lot of people are moving around not knowing if they have or not. Because if I don't have symptoms, I have no reason to go to the hospital for test or anything. So how is that possible? Because some, I must be sincere with you, some of our people feel this COVID of a thing is not still real. They believe it's not real, and we are trying to pass the information across to them that this is real. And when some questions are being passed across to us, we ourselves, we don't have the full answer to give to them. And so if such person comes to me, okay, they said I had COVID, but there was no symptoms, what could be the cause or something?
No, it is true that it depends on the age group, but with younger people and especially with children, you have many people who don't feel that they have corona. So the COVID in young people, it only makes symptoms for more or less 50 to 70%. So you have 30 to 50% of young people who don't feel that they get COVID. And especially in children, they don't feel. In older people, like people older than 70 years old, most of them feel that they have COVID, but there are still 20% more or less who don't feel it. So the ones that don't feel it, they are just lucky. It is as well with other viruses. So with influenza, with the flu as well, you have people that have influenza, but they don't feel it. Yeah, we test them in the hospital when they come with something completely different, and some people don't feel it. That's just the normal way that how viruses are behaving. So it is always the case that you have some people being asymptomatic, and for them, it doesn't seem to be a problem. Sometimes the people who are having no symptoms, they can still have long-term problems. So the long COVID problem that you might be for some weeks or months, you might be very weak and feel breathless very frequently. That still might happen, even though you didn't even feel in the beginning that you had COVID. So it is a normal thing. In younger people, 20 to 50% don't feel that they have COVID.
Okay, thank you very much for that.
It's
And
tricky, unfortunately.
yeah, I also have a question here.
Mhm.
It's been said probably across all the living houses yet that they want to they are bringing vaccines for the women, and don't let me say for the women, for everyone. But now we heard and Johnson is also being set aside, not for the young people. So which is the best for us to take now? Which of the vaccines
Yeah,
can
they
you
will,
give us?
like if they come to vaccinate you, they will give you either the BioNTech or Moderna. That's the two that are for younger people at the moment. And they are both fine.
Okay, Moderna. Okay, thank you very much. Okay, about
You're welcome.
the Moderna. Okay, so and lastly, um probably there is someone, the health system in Germany is a little bit different from the health system we have in Africa.
Mm.
Most times, even when we have fever, we have headache, we use just normal drugs like self medication. So we have a lot of like some people with underlying ailments and they don't know. So what advice can you give to such people? Okay, a lot of people don't know they have this, they don't know they have ulcer, they don't know they have like other ailments. So is it possible, or should they first go for some tests to be sure they are in the right position, or in their health system is okay for them to take the vaccine, or what?
I'm not completely sure if I understood the question correctly. So the
We have a lot of people with underlying ailments and they don't know.
with
And
underlying diseases.
yeah,
Yeah,
and they don't know.
yeah.
What advice can you
Um,
give to such people?
Generally, it's the vaccine is not dangerous for people having a different disease. Okay, so even if you have, like, if you would have HIV, or you have hepatitis, or you have a cancer and you don't know it, or anything else, the only thing that can happen is that the vaccine doesn't give you the biggest protection. Yeah, so especially for people with a bad immune system and for sick people, they are the ones that should be vaccinated first, because they have the highest risk of having a severe disease of COVID. So actually people who have cancer, who have a bad immune system, who have HIV, who have hepatitis or anything else, we would vaccinate these people first. And just to offer them protection against COVID. It is not that for cancer patients, for example, it will not make the disease they had before, it will not make it worse, or it will not have any effect on it. And it is not a problem for any disease. So at the moment, we would recommend to vaccinate everyone who has a disease first, to be protected against COVID. So in that way, it's no problem.
Okay. And also, my last question: at what stage will the children start getting vaccinated, like the children?
Yeah, that is more or less the same problem as with the lactating and pregnant mothers. So in the first studies, they didn't examine children, they didn't test them. So at the moment, there are several studies running where they test the vaccines on children over 6 years, I think, so far. So it will take, I think, 2, 3, 4 more months, and then we will know better what to do and which vaccines to give with children. Children have a very, very strong immune system, so they do respond even more to vaccines than what we do. So we would expect them to have more fever, to have more headache, and so on after a normal vaccine. And often you need to make a dose reduction. That means the vaccine needs to be weaker for children because they react stronger. But at the moment, there are several studies where they examine all these questions to be able to make good recommendations. In Germany, I think for the BioNTech, you can vaccinate everybody over 16 years old. And as well, again, in the UK, they have already decided that they will start vaccinating children by now. But yeah, we still don't have enough data, but it's on the way, it's coming.
So thank you very much for those answers. Nora, I don't know if you still have questions. And also our women, do you have any question? Please feel
Yeah,
free.
I want to ask one more question. Do we still have to wear masks after having been vaccinated? If so, I want to know why. If we still have to wear the mask.
Yeah. For the vaccination, I said before, we need 2 vaccines, and then we need to wait another more or less 2 weeks until we are fully protected. When we have this vaccine cover then, and our immune system is good to fight against COVID, we are a lot less likely to transmit the virus to other people. But at the moment, we still have many people who are not vaccinated. And for them, it might be that even though we can only transmit it with a very low probability, that it's still dangerous for them to get the coronavirus from us. So I think in the long run, they will as well stop people being vaccinated having to wear masks. But I would imagine that this takes quite a while until really everybody is vaccinated. And there will probably be some people as well that will not be able to be vaccinated because they are allergic or something like that. So for them, it is still dangerous. Probably we will not have many problems when we are vaccinated that we will transmit it to others. But we don't know yet, like with the new variants, you probably have heard that in the UK and in South Africa and in Brazil, they have slightly different mutated coronavirus, that these coronaviruses, they are even better to be transmitted from one person to another. So you need less virus to infect a person than before. And I think as well for this question, we will get the data soon, but we don't know 100% if really nobody can transmit the virus. I think in the next 2, 3, 4 months again, we will know more, because by now, yeah, they started worldwide vaccination in December, January. So it will be the next 3, 4, 5 months that will show us how much this works. But the first data say it's quite good, so that probably the masks we won't need to wear anymore in the future.
Okay. Thank you very much. Noah? We
If
can
there
take
are no more questions,
Yeah.
yes.
So yeah, I have just one. Is it possible for someone who has been infected before to be fully healed, like without corona like virus again? Can someone be fully healed?
Cute?
Can someone who has been infected with coronavirus before be fully healed? Like, can I say I had coronavirus before, but now I don't have it anymore? Because I have a friend, he was being tested. He had coronavirus at first, and later he was being discharged. Like, okay, go home. And after then, he went for test again, and it came out positive.
Mm-hmm.
So
Yeah, we have many patients like that. So so when I do the test, normally I do the test through my nose. So right in the back of my nose, about 7-8 centimeters in the back of my nose. Normally I have the highest viral load of coronavirus. So when I make a test, I normally go inside with a swab to get this virus. But there are different obstacles why a test can be false negative. It could be that I didn't push it right until the back. It could be that I take too long to send this test to the laboratory, then it will turn out negative. It can be as well that for a person who had the disease already, that it's not in the nose anymore, but that it went down to the lungs. And then I can't prove it anymore in the nose to have coronavirus, but I only can prove it when I take sputum from the lungs. So this can change, and there's as well some variation between one person and the next person, and as well in the same person. It can be one day you have more virus, and then you have less virus, and then you have more virus again. In most of the people, it is like after 2 weeks, it is only a very slightly rest of coronavirus that some of them might show, and that normally is not infectious. Yeah, so normally after 10, 14 days, the rest that still turns out positive is kind of dead virus, or a virus that cannot infect others. But for example, we had a patient who had a very, very weak immune system, who had many other diseases, and she was on and off positive for 4 months. So during these 4 months, we did twice a week, we did a test, and she was positive, negative, negative, positive, positive, negative, positive, negative, positive, always changing. So for people with a very weak immune system, it can take many, many months to be cleared. For others, it can still be like 10, 14 days, but usually then it is not infectious to other people anymore.
Okay, thank you very much. So that's my last question. Barbara, Nora, Pelin, I don't know if you have any other question. And our women, please, do you have any other question, or have we asked everything on your behalf?
Yes.
Okay. So I think at this point I'll hand over to Pelin. I think we're done.
Okay. If there are no more questions, then we appreciate your presence here. And until the next time, and to Christiane, to Frau Dr. Piepel, I thank a lot for your information and advices. And yeah, I thank a lot for your presence for all. And yeah, and thank you for online coming to all. And I see you in the next time. Take a good time and take care.
Yeah. Thank
Bye.
you very
Thank
much.
you and bye.
Bye.
Bye. Thank you. Bye.